KLLY 95.3. Good morning. We have from Beautologie, a friend of the morning show, Dr. Siporin on. Good morning, sir.
Good morning. Thanks for having me on.
Of course, we love having you on. Anybody who can help men or women with hair issues is a friend of the show. As we all know, I got so frustrated I shaved my head.
Yep.
And now I'm bald.
Well, if it looks good on you, I'm all for it.
Well, I don't know if it looks good, but...
But the other way was just not working.
I looked like 100 years old the other way.
Well, listen, I don't go running down the street chasing after bald people and tell them they need it. But hey, when I was young and I started losing my hair, it just wasn't for me. I looked in the mirror and it drove me crazy.
Yeah.
So I can relate to people who just don't take hair loss sitting down and want to do something about it, especially now in 2011. My God, we can do it so naturally that virtually nobody can detect a hair transplant anymore. So basically, where we are in 2011 is a guy sitting in the mirror starts seeing some balding. You have a choice. You have a choice in our day and age to not go bald.
And you finally have a choice with several different options, right? Like, what are the different ways you can do it now?
Yeah, there's a couple different main options right now, and then on the horizon, I'd like to tell you about this little investigation I'm in a second towards the end. But the two basic options are taking a strip out, which leaves you with a scar. Now, the scar's not visible unless you shave your head. So, but some guys, they come and they go, I'm not sure. Maybe I want to shave my head in the future. Maybe, I don't know. I don't like to shave my head now, but like you decided to shave your head.
Yeah.
Some guys want the option that even if they do a transplant, if they shave their head, there's no visible scar. And we now have that option. And that is something called a follicular unit extraction. It's very time-consuming for me, for the patient. It's kind of relaxing. I give them a little medication. They're like, whoo-hoo.
Are they awake?
They're happy in the chair just lying away. But we remove the hairs one at a time with this tiny little instrument that goes around each little hair follicle, and then we pull the hairs out one at a time and put them in a new home.
Wow.
So if you want to shave your head, you can't see a scar because there's these just tiny little incisions that heal with I don't want to say no scar, but you can't detect it as a scar.
Yeah.
Because, when you look up at the sky at night, if you saw a bunch of stars in a row, you would say, "Whoa, that's what's that weird formation?" Where if the stars are all scattered, you just kind of just look at them and go, "That's kind of pretty." But if it's a straight line, it's a formation that kind of stands out as a scar. So the new technique, really, you could shave your head and no one would know you had anything.
Now, Dr. Siporin, you're awake during this procedure?
Yes, you're awake to varying degrees. I mean, you're not out under general anesthesia like if you were undergoing a liposuction or a facelift or a breast augmentation, which, they put you out to sleep. That's general anesthesia. We give patients some comfort medication. I kind of call it, maybe a margarita in a pill.
Nice.
Yeah.
It just kind of relaxes them. Actually, right now, it's funny. I'm doing a transplant right now. I just left the room. The patient is just snoozing around. He actually is so comfortable, he's enjoying my singing.
Really?
Yeah, that kind of tells you.
That's awesome.
Tells you how relaxed he is.
Right, and it's Michael Jackson in the background. He thinks it's you. Okay, so how long is a procedure like this? How long is your patient right now? How long is he going to have to...
Depends on how bald they are, right?
You mean how long does the procedure take?
Yes.
Yeah, he got here about 7:30 in the morning, and he'll probably leave by 12:31.
Nice.
Not bad.
I'm doing a number of grafts. I'm doing his whole hairline and and back a little bit, but he has some hair. So yeah, it depends on how big. We could do really big cases that take up to 8 hours.
Wow.
But you're not asleep that whole time. You get up, you can watch a movie, listen to music, go to the bathroom, have lunch. Mm-hmm. So it's not, like you're lying still that entire time.
That's amazing. So what is this? What is this third experimental way you were talking about?
Okay, I am working. I'm not solely working. It's not just me, but I'm part of a nationwide study which is looking at using stem cells to grow hair, which is really exciting. So this research is being conducted, mostly centered in Atlanta, but there's a few investigators in LA, and I was lucky enough to be chosen as one. And what we're going to do is take a small biopsy out of the back of some balding guys' heads, but they still have hair on the back of their head. We take a little biopsy, we send it off to a lab. They grow those cells in a culture, in a laboratory, while the patient's home, doing whatever it is he does. We're growing those cells in a lab, and we're trying to isolate the stem cells and make it into a solution that 2 weeks after we do that biopsy, the patient comes back in, and we inject those stem cells, what we think are stem cells, into different boxes that have been tattooed on the bald scalp, and at different concentrations to see if we can grow hair where there is no hair.
Now, how's that?
Injections.
Have you tried it yet?
No, we're just starting. So the research is just getting underway.
Oh.
So,
well, if you need a patient,
time you have me on, I'll be able to give you some good news.
If you need a patient who was willing to make $50 a day and also get injected, that's me. I'm that guy.
Okay, do you want to give your number out over the air, and I'll call you if I can get you in the study?
Perfect, easy, done.
He'll do it.
I'd do it in a heartbeat. I love experimenting.
Me too.
Oh,
hey,
hey,
all right, come on, thank
hey.
you. Tip the waiter. All right. Well, Beautologie, a fun place, and it's full of great doctors, and they're always friends of the show. We love talking to all you guys. Go to our website, KLLY.com. Look under Friends of the Morning Show. You will see Beautologie and get all the information you need. Again, Dr. Siporin, we appreciate you, and we are so glad you're here in Bakersfield helping hair grow again.
And this is also good for women, too, right?
Absolutely.
Yeah.
Definitely.
Which is actually, I think, and I may be wrong, I know it's devastating for men, but it's got to be more devastating for women.
Oh, absolutely. It's our society places such a premium on beauty for women, and nothing is more important in terms of beauty for women than their hair.
Their hair.
Yep, even armpit hair, leg hair, all that stuff.
Yeah. So I am seeing more and more women, and we actually have some new tools to help fight hair loss in women as well. I mean, ultimately, the stem cells are going to be the most powerful tool once, and it will be done. We will get stem cells to grow hair on the scalp. I'm not sure if it's going to be this year or next year or the year after, but we're also using lasers, and we're getting a lot of women to grow hair without anything, without any surgery, just with this red light that they, buy, and they put it on under a cap, and they sit under this laser, which is just a red light, a few times a week. And 40 to 50% of women are experiencing a significant thickening of their hair. So that's another exciting.
I need that because I'm losing hair. Seriously.
You have plenty of hair.
I would be bald. I have what many people would consider a full head of hair, but I'm telling you, I was bald. So I totally sympathize and empathize with anybody who's losing hair, because I certainly didn't like it. And women, it's terrible.
It's worse.
Right on. Well, we appreciate you coming in, being on the show. You're awesome.
Well, thanks for having me. I always have fun talking to you guys.
Oh, yeah. We look forward to talking to you again. Have a good one, and we'll see you next week.
You too. Take care, guys.
Bye-bye.
Bye.
Bye-bye.